Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is our COVID-19 briefing for British Columbia for Monday, August the 10th. We're honored to be here on the territories of the Lekwungen-speaking people of the Songhees and the Esquimalt First Nations. Tomorrow, Tuesday, we'll be providing a written report, as we will Wednesday, on case counts and other relevant issues with COVID-19 in British Columbia. On Thursday, we'll be providing another in-person briefing that will include some new information about our research into COVID-19 in British Columbia on Thursday that Dr. Henry will be providing. And with that, it's my honor to introduce Dr. Bonnie Henry.
Thank you, and good afternoon. So today we're reporting on 3 periods from Friday to Saturday. We had 50 new cases. Saturday to Sunday, there were 37 people identified with COVID-19, and from Sunday to today, an additional 44 people. That brings us to 131 new cases in the last 3 days, including 1 epidemiologic link cases, bringing our total in British Columbia to 4,065 people diagnosed with COVID-19. That includes 1,220 in the Vancouver Coastal Health Region, 2,139 people in Fraser Health Region, 148 people on Vancouver Island Health Region, 391 people in the Interior Health Region, 96 people in the Northern Health Region, and 71 people who are here who reside outside of Canada. We now have 445 active cases across the province, including in all health authorities, of whom 9 are in hospital currently, 3 of whom are in critical care or ICU. We have had no new deaths over the last 3 days, leaving our total at 195 people who have died from COVID-19. In addition, we have 3,425 people who have recovered, and we currently are following 1,765 people who have been close contacts of a case of COVID-19 are under active daily follow-up with public health. Over the weekend, we have had 2 new healthcare outbreaks in the Fraser Health Region, one of which is at the George Derby Centre, long-term care facility. So this is a centre that is separate from but related to the Derby Manor outbreak that we declared last week. As well, there's an additional case at the New Vista Care Centre, and Fraser Health is on site with teams responding actively to all of those outbreaks. That brings us to 8 now active outbreaks in our health system, 7 of which are in long-term care or assisted living, and 1 in acute care. There are 673 cases associated with these outbreaks in our health system, 406 residents and 267 staff involved. We have no new community outbreaks. However, we continue to see exposure events, and those community exposure alerts have been posted on health authority websites, as we know. There have been a number of new locations over the past few days, and a number of new flights where people who have had COVID-19 have been on board coming into and out of British Columbia. So please check each health authority website and follow the guidance of public health teams. I do want to say, though, that we have been working, as I talk about a lot, the contact tracing that we're doing and how the management of people who have COVID-19, every single case is followed up and linked, and that is working. With the numbers that we see from the past few days have reflected the intense work that my colleagues across the province in public health are doing on tracking down those people who were at those events, many of them young people at social events where they intermingled. And we're doing what we call social network analysis to make sure that we're finding people. And many of those people, the vast majority of the people who tested positive over the past 3 days were people who were on our contact list, who were amongst the 1,500, 1,700 people who are in active daily follow-up. And that means that as they developed their illness, they were isolated and they no longer exposed others, breaking those chains of transmission. This is incredibly important because this is how we know we can manage with the cases that we're seeing here in British Columbia. Having said that, We need to do better collectively to stop these exposure events from happening. Our layers of protection reduce the spread of COVID-19. We know that works. We know we can do it. We help all of us stay safe, whether we're at work, at school, out with friends. What I can tell you is that parties and gatherings with young people many of whom you don't know, even if there are fewer than 50 people, are a concern. And we have seen that. We saw that on the July 1st long weekend. We've seen it across the province where people have been coming together and having group gatherings with different people and not maintaining distances, safe distances from people they don't know. This is because people are often inside and in close contact with crowds of people that they don't know for several hours. And we've had a little bit of some work being done by teams across the province to ensure that some of these parties have been broken up, including there have been some fines levied on some as well. We know that when alcohol is involved for many, the precautions that we would normally take can diminish. So if your friends invite you to a party and it doesn't feel right, don't go. There's no better excuse than a global pandemic to be able to do the right thing and encourage your friends to do the right thing too. As well, we need to remind people that these are there, these guidance and these documents, these orders that are in place are for all of our protection and for protection of our community here in BC. And so when people are traveling here, if you're visiting from other provinces or from out of country and you finished your quarantine, do not ask people to break these rules. They are there for the safety of everybody in establishments like restaurants and bars and other places. We need to be in this together. We need to keep our group small, and we need to support each other in keeping these layers of protection in place. We are in a time when we know people can unknowingly spread the virus to others, particularly young people who are feeling well and may quite easily spread it. And these are why these precautions we take right now are important for all of us. And these next 2 weeks will again be critical for us. We need to hold our line and bend our curve back down where it belongs. As we increase our time with others and restart activities across BC, I know that spending more time with others can be a source of anxiety for many. And that's why we have to pay attention. In particular, I know parents and families are worried about the restart of in-class learning in the fall. This anxiety, this fear, this not knowing what it's going to look like in the face of a global pandemic is perfectly normal. We are all feeling that, and I understand that. Schools will look different. We have to put aside what classes were like in March or even in June, and we learn from what we know about this virus and about how it spreads and about things that we can do around the world. It's important to remember that the layers of protection we use at work, at grocery stores, in restaurants, will also be used in our schools. That is part of the plan. They are the foundation and the backstop for all of us. Limiting the time with others, using one-way pathways, cleaning more, washing hands regularly, and always, always, always staying home if we're unwell are important measures that will be used in our schools every day. Reducing the numbers of people in the school, and that's parents and others who would normally come in, staggering times, use of distances, keeping groups smaller, making sure that the number of people who are in a group are maxed at a certain number, using masks when it's appropriate. These are all things that we will be doing in our schools. But we need to come together locally and make the framework that we've given out work for all our children in our local situations. And that work is being done now, and parents can be involved in that. The Back to School plan has been developed to ensure that these layers are there. Like for every other sector, we've worked with the Ministry of Education, with teachers, with parents, with school districts, to have a framework that every school then needs to adapt to its own situation, its own community. And that is what is happening now. Each school and school district is now taking the overall framework with the guidance in place and applying it to their schools. This will ensure the layers of protection are there. from the first day to the last day of the school year. You will see such things as staggered start times, staggered recesses and lunches. And we talk about the layer of learning groups. That means that it may be that 2 or 3 classes all start at the same time and have recess at the same time. It doesn't mean that all of those children will be intermingling every day. It means they may go for recess at the same time, but they'll be in different areas of the schoolyard. We will be looking at the important innovative things that teachers and parents and schools have been thinking about outside classrooms, about how they can increase ventilation, how they can safely have smaller groups, and how we can have physical distancing, and in particular making sure that we're not having physical contact on a regular basis, particularly for young children. So each school district and school will be developing their own COVID safety plan within the framework, and that's what parents and teachers and the rest of us will be looking for in the coming weeks. We need to work together, and we need to use all of those great ideas that are out there to make sure that this is safe. It is that important for our children and for the future that we are able to manage this and make sure that our children get what they need in their education system coming into the next year. Because this virus is going to be with us, and we need to be able to manage it and support our children. COVID-19 has created incredible uncertainty and concern, and all of us feel that. But let's not forget, we have shown how to slow the spread of this virus, and we know we can keep our communities safe. It's about monitoring closely, doing our part to minimizing the risks, managing the number of new cases, and that's something that we do in public health with you, modifying our actions as needed. We will be flexible as we move forward, and we will learn from every outbreak, every encounter we have. This is what will keep us safe and protect the people that we care for, and protect those most at risk, particularly our seniors and elders. So let's keep going. Let's all do our best every day, each and every day. And let's also continue to be kind, to be calm, and to be safe.
Thank you very much, Dr. Henry, and of course we are gratified that over the 3 days of the weekend no one has passed away from COVID-19. We remember the 195 people who have passed away since the beginning of the pandemic and their families. And we note that there are fewer people hospitalized than there were on Friday. I think from 11 to 9 there are fewer people in critical care than there were on Friday. And yet there are, of course, more cases, 131 more cases over the last number of days. And this is the circumstance and this moment in the pandemic that we're in that Dr. Henry, I think, has just described very well. It's a moment in the pandemic where we've reduced the number of people passing away from COVID-19. As an example, 8 people have passed away in the last 4 weeks in British Columbia, and we mourn them. 48 have passed away with a smaller population in Alberta, and 272 in that time in Washington State. And that just tells us a little bit about the nature of the pandemic in these different places, and that everyone in those jurisdictions, as here, are struggling with their specific circumstances. And our specific circumstances include, as you can see by the case numbers and how they've been described and how they're shown on the BC CDC dashboard, which goes out every day, is relatively speaking younger people testing positive for COVID-19. And when we talk about younger people, we're talking about people between 20 and 39. And so I think it's not fair to describe or ascribe all that to youth. There are people in those categories with lots of experience who are struggling with this. Nor is it fair, and we don't do this, to blame those who have tested positive. There are people who may have gone to parties that didn't test positive, that aren't sick, and their circumstances, and the circumstances of those who are, should be the subject of care and not the subject of scorn. But that said, we do need to continue, and as we've noted before, to take action, the very actions that are required. Some of that will require enforcement, and you've seen some of that over the weekend. Some of that will require all of us reaching out to the people we know, and some of it will involves our individual actions, our saying no to going to private parties of a sort where we don't know everybody, and saying no to organizing such parties. And I think that's something that we can help each other with in the community. And to do that, we are and will be finding people on social media and influencers. But I want to say to everyone out there, we are all influencers. And we can all influence the behavior of ourselves, first of all, but of the people around us, and how we behave, how we say no respectfully to behavior that is unwise in the context of a pandemic and goes contrary to the advice of Dr. Henry, is an important way that all of us can participate in stopping the spread. Today I'll be providing my weekly update on PPE. To recap our cumulative totals from March to last week's report on Tuesday, August 4th, the following PPE has arrived in BC. Just over 6 million N95 or equivalent respirators. That's 5% of which comes from the federal government's bulk procurement. 36 million surgical masks or procedure masks. 2,400,000 pieces of eye protection, including goggles and face shields. 75 million pairs of gloves. 4,700,000 gowns. Many of the items I've just listed are in our ongoing testing processes to make sure product meets or exceeds safety requirements being used in BC's healthcare system. Today I can tell you that over the last week, since my last update on Tuesday, August 4th, until yesterday, we've received the following. 41,437 N95 or equivalent respirators, 6,253,750 surgical or procedure masks, 2,145 pieces of eye protection, 977,950 pairs of gloves, and 871,950 gowns. We'll, of course, continue to source and test our PPE and are working hard to pursue any and all credible leads for safe and effective product, as well as working with the private sector and other jurisdictions in Canada, including the federal government, to develop domestic suppliers. In closing, I want to say this, that our task this summer was to renew BC without rebooting the virus. Our number of new cases is climbing, and it's climbing to levels that we haven't seen in a number of months. The number of people now in self-isolation is disturbing. While some increase was expected, each of us knows our numbers are too high. And we probably think that 10 is too high, but certainly approximately 44 a day is too high. And that by doing so, we have the potential of undoing the work we've all done. And that while people may think that these things aren't linked to vulnerable people, in fact, we know that they are. There are about 150,000 people who work in our healthcare system, 47,000 people who work in long-term care. If there's more community transmission, inevitably it's going to affect people who work in healthcare, who work with some of our most vulnerable people in societies. And that's why we have to make sure we're still 100% committed when it's just us, out by ourselves buying groceries, stopping in at a coffee shop or running errands in local stores. We must make sure we're 100% committed when it's with those in our bubble and we're getting together in our homes, in our parks, or our restaurants. We have to be committed to taking the actions you need to take, following the advice of public health officials, following the advice of Dr. Henry, and doing the right thing. We've all got to use our COVID sense. We need to use it every day. We need to say enough to private parties where alcohol is being used, that where physical distancing is impossible. We simply have to say enough. And if those we care about need a reminder, or we encounter somebody who's not using their COVID sense, that's when we use our COVID courtesy to kindly and firmly help them stop the spread too. In our BC fight, we count on each other. Right now, each of us has to use the influence we have, the trust we've earned, and the bonds we've built with family and friends to reach out and make sure that across BC, we're all recommitting to the behavior that works. Use our COVID sense, show our COVID courtesy, stop the spread. When we let our guard down, we invite COVID-19 into our homes. It's time to take in that welcome mat. Aujourd'hui, nous faisons le point sur le nombre de nouveaux cas pour 3 périodes de référence de 24 heures chacune, soit celle du 7 et 8 août, celle des 8 et 9 août et celle du 9 jusqu'au 10 août en mi-journée. Nous sommes reconnaissants qu'il n'y a eu aucun des nouveaux décès liés au COVID-19 durant ces 3 périodes de référence. Nous continuons à offrir nos condoléances aux familles et aux amis des 195 personnes décédées du COVID-19 et tous ceux qui ont perdu des êtres chers au cours de cette pandémie. À ce jour, 3425 personnes dont le test de dépistage de COVID-19 était positif sont maintenant rétablies. Pour la première période de référence, jusqu'au 8 août, nous avons eu 50 nouveaux cas. Pour la deuxième période de référence, qui s'étend jusqu'au 9 août, nous avons eu 37 nouveaux cas. Au cours des dernières 24 heures, 44 nouveaux cas se sont ajoutés. Cela représente 131 nouveaux cas depuis notre dernière mise à jour vendredi pour un total de 4065 cas en Colombie-Britannique. Parmi l'ensemble des personnes, des cas confirmés de COVID-19, 9 personnes sont actuellement hospitalisées, dont 3 en soins intensifs. Merci beaucoup. Thank you very much. We're happy to take your questions.
Thank you, Minister. As a reminder to everybody on the phone, please press star 1 to enter the queue. You are limited to 1 question and 1 follow-up only. Please take your phones off mute. You will not be audible until I call your name. First question is from Ian Bailey, Globe and Mail.
Question to Dr. Henry. Given the latest numbers from Health Canada that they show that the BC and Nova Scotia are leading the country in increases in cases among young people, wondering why BC is not flat out requiring masks in classes and whether that will change.
Yeah, I'm not sure I see the connection between the young people in their 20s and 30s who we're seeing now contract the illness and wearing masks in classes. And I will say that none of the provinces have required masking of all students in classes. And there's very little evidence that that is a measure that's going to protect people. We know that there is a place for masks. They are the point, the end of our hierarchy of controls, the layers that we need, the least effective of the layers that we need. So I absolutely believe there's a role for masks in places in our school setting, particularly for teachers and administrators when they cannot maintain distances in particular. But we also know that masks can interfere with the ability to learn. So I think there's a lot more that we need to understand. But right now, the role of masks in our schools will be in those settings where we cannot maintain physical distancing within things like hallways sometimes and settings like that for older children. So that's what we will continue to do, and we'll continue to evaluate and reevaluate and learn as we go.
Do you have a follow-up, Ian?
Yeah, are you confident that youngsters will be able to sort of properly use masks in the chaos of the school system? Later on that, I know the BCTF is pushing for more masking in schools.
Yeah, so I think that's one of the things that we need to do right now is socialize the use of masks and help our children understand where and when they use them and how to use them properly. And that is something that I know young people in my life were working on, and it is a challenge. And certainly, to think of particularly a young child, 10, 11, 12, sitting all day in a classroom with a mask on is probably not realistic. There's lots of things that we can do to make those environments safe without requiring somebody to sit with a mask on for the long periods of time. So that's what we'll be looking at. We are looking, of course, to making sure that we're following all of the data on transmission in children and on use of masks in children, and we'll continue to adapt and to adjust as we go forward.
Next question is from Shannon Patterson, CTV.
Oh, hi, Dr. Henry and Minister. I don't know if you saw the story about the party bus on Saturday that pulled up to a bar on Granville Street, and dozens of people piled out trying to get into a bar. The bar said no. The bar wouldn't let them in. But do you have concerns that these party buses are still running, that this type of activity is still happening, and that I spoke to an industry rep who said they're still having issues with people following the rules at bars and nightclubs?
I know, and I've heard from that from restaurants that I go to, and you know what we reiterate is the importance. These are measures that are in there to protect all of us, and we should not be putting staff and people who work in those settings at risk, which is what we do. And we have modified the orders to make sure that we can support those venues in standing up when people are asking them to break those rules, because we will cause the business to be shut down. The businesses can be fined. So we need to all understand that these rules are in place for a reason, and we do have orders that apply to restaurants and pubs and nightclubs, and you know, party buses. If they're all people that are part of your social bubble, then and they're smaller than 50, maybe it works. But I still have concerns about that, and I know both WorkSafe and our bylaw officers and our public health inspectors are working together to support businesses in being able to make sure that they are effectively able to deal with this. But we all have a responsibility to not try and put people in those impossible and dangerous situations. And that's where we need to collectively talk to our friends about what is appropriate behavior or not. And I mentioned it again today, asking restaurant owners or pub owners or nightclub owners to break the rules is just not appropriate.
Do you have a follow-up, Shannon?
Yeah, on a different topic, the production of The Good Doctor, the television show, has been halted over a disagreement about how many times the crew should be tested. The production team wants people tested every 3 days. The union doesn't like that idea. What are your thoughts on this? Should we be testing more? Should employees be allowed to set standards, or employers allowed to set standards on how often employees can be tested?
Yeah, so these are all delicate negotiations between the union and the production company, I understand. And, you know, that we have parameters that we have in place to keep workplaces safe, and WorkSafe BC has some very detailed parameters for productions like this one, and we expect those to be adhered to. So I am sure that everybody wants safety as their primary aim, and they will work together to come to an agreement around this issue.
Next question is from Richard Zussman, Global News.
Dr. Henry, one of the things that we hear a lot about around return to school are grandparents who participate in the day-to-day caring of children. What are your advice towards grandparents who are looking at a return to September? They're worried about their own health. Should they continue to be part of after or before school care, or part of the care network associated with a child?
Yeah, and again, you know, these are very difficult questions to answer for everybody. But the short answer is yes. If you're part of that child's bubble and have been playing that role, then you as a family need to make sure that you're doing it in the safest way possible. We are putting in place the health measures to make sure schools are safe, to reduce the possibility of transmission in those settings, and we are confident that we know how to manage it should anybody come to school with COVID-19. Grandparents need to look at their own risk. They play such an important role in children's lives, and it supports families. We've heard this from many, many families that, that before and after care from grandparents. But then we may need to think about, okay, what is it that I do at work? Maybe we need to reduce our social bubble. Maybe our children don't go to other activities outside of the school setting, so that we reduce our overall risk as a family. So those are the things that individually families have to think about.
Do you have a follow-up, Richard?
I do. Just on this issue around masks, where do you believe that it will be appropriate in a school setting to have masks? And can you explain a little bit more? I've heard a lot of feedback since your comments last week around physical distancing in terms of what alterations can be made in the classroom, especially when there's fixed space and fixed desks that could allow for a semblance of physical distancing inside of a classroom.
Yeah, so there's lots of things that we know around how this virus is transmitted in those settings. So there's the way people are sitting, which way they're facing, whether they have distance between them, the types of activities you're doing. So every setting is different, but there are opportunities for schools to look at that. It obviously, it's reflected in numbers in classrooms. It's reflected in the ability to remove a lot of stuff that may be in classrooms, so minimizing the amount of other things that are in the classroom, furniture, etc. Looking at ventilation and how to improve ventilation. I think masking is really important in those situations where particularly adults are getting together, or older children are in situations where they can't maintain at least a meter distance. And those are the types of things that every school will have to look at. There is a role for masks, absolutely, but they are, as I've said, sort of one of the layers of protection that we have, and we're building in many layers. And I think there's been a lot of confusion about the term that we've been using of cohorts or learning groups, and the fact that some people believe that means they're going to have close contact with 60 people every day, which is not the concept at all. It's maximizing the number of people over the semester or the whole year that children will have contact with, and that includes all of the children and the staff in that sort of maximum number. So for most schools it'll be much smaller than that, but that does give ability to stagger groups of classes together, for example, so that you're able to stagger arrival times and resets and lunches and make it work on outside classes, for example. And we need to, there's lots of great ideas that I've been hearing both from teachers and principals and parents about how to do some really neat, innovative things that will help children. Things like having outdoor classes, like looking at how they can have safe interactions in smaller groups, socially distant or physically distanced. So I think there is a lot of learning that we can take from other countries on how they've done this safely. And I will also reflect that what happens in schools reflects what's happening in our communities. And that's why all of us have to pay attention to what we're doing to keep our communities safe. Where we've seen large outbreaks or numbers of both staff and students get sick in school settings, it's when there's been high numbers in the community as well. And so we need to do our bit over the next few weeks to make sure that our children, because of the importance of getting back into that in-classroom learning for a whole variety of reasons, that we're able to do that in every community here in BC.
Marcella Bernardo, News 1130.
Hi, Dr. Henry. Just in keeping with what happened in recent weeks with large parties, now that 3 Vancouver police officers have tested positive for the virus after breaking up a large house party downtown, and it's obvious that these gatherings are still happening, do you believe enough is being done to stop them? And what more can be done to ensure your public safety orders are actually being enforced?
Yeah, I know it's very challenging, and as you know, we always start with the carrot versus the stick. And I continue to believe that if we tell people why it is so important, and we put in the parameters where we know things are going wrong, and we've seen that we've had more enforcement in those settings that we have control over, and we do know that law enforcement and bylaw officers, the order around 50 is something that can lead to fines, and in addition to nuisance behavior and noise complaints and other behaviors. So I know my colleagues in public health are working with their municipal and public safety communities to put together approaches that help support us stopping these types of gatherings that put our whole communities at risk.
Do you have a follow-up question, Marcella?
Yes, regarding the outbreaks at care homes in the Lower Mainland, what's being done to ensure staff members are not actually bringing the virus into these places? Because last week you did make a point of telling health workers and other frontline employees to avoid large gatherings and parties because they're putting other people at risk.
Bella, you're going to have to repeat yourself. Your question cut off.
Oh, sorry. Just regarding all the outbreaks at the care homes in the Lower Mainland, what's being done to ensure staff members are not bringing the virus into these places? Because last week, Dr. Henry made a point of telling healthcare workers and other frontline employees to avoid large gatherings and parties because they could be putting other people at risk.
And that is something I will say that all of the newer outbreaks that we've had have been identified with a single case, which tells us that we're catching things earlier. And there are screening protocols for every healthcare worker going into every setting every day, and those are helping. And we are also identifying people who are contacts. So some have been related to social events, but we also know that there's been workplace outbreaks that we've seen, particularly in the blueberry packing facility, for example. And people who work in those facilities often live, or essential workers who are going back and forth to the United States, for example, may live with a healthcare worker. So there are many reasons why these things happen. But yes, screening is incredibly important, and making sure that we have a very robust protocol now for detecting cases early and for having an outbreak team on site immediately to manage, to assess everybody, so all of the residents, all of the healthcare workers. And that's what we're trying to do to manage and contain these. But I do believe we as healthcare workers do have an obligation right now during this pandemic, recognizing the risk that is all around us. We're looking at jurisdictions all around us, and it's not surprising that we are being affected as well. But we need to make sure that we're keeping our families and our colleagues and the people we care for safe. We've known from the very beginning that the people we are most likely to transmit this virus to are the people we're closest to. And that means we have to take extra precautions when we're working with with people who are at such risk as our seniors and elders in care homes.
Next question is from Rochelle Baker, National Observer.
Hi there. Can you hear me okay? Can you hear me okay?
Yep, we can hear you.
Okay, great. Thanks for taking my question. Dr. Henry, again, a return to masks in the classroom. The BCTF has expressed some concerns, regardless of confusion around the cohort model, that even the typical class size of 30 students or so would be very difficult to ensure any real sense of physical distancing between students. Some parents and teachers with that in the backs of their mind are talking to us about they would love to see masks mandated in a classroom situation. The Canadian Public Health Officer made recommendations around children 10 and up wearing masks. Children do go home at the end of the day to their families, some who may be immune compromised and whose parents perhaps work in the wider world. Is there not a role for masks in the classroom as an added layer of protection?
So as I've said several times, there is a role for masks, and there is absolutely permissive roles for children to wear masks. We know, though, that masks are the least effective part of our layers of protection, and we will be building all of those into our school system to make sure that we can have safe and effective education of our children in the best possible way, given that we're in a global pandemic. And what we are saying aligns completely with what Dr. Teresa Tam was saying, that it's recommended for older children in those situations where it's important. And I think we need to also remember where some physical distancing can't be said. She did not in any way say it should be mandated in any school situation. So we also have to remember, as I've said, that it's what happens in the school reflects what's happening in our community, and that's why it is so important for all of us, to continue to do what we need to do to prevent transmission of this virus, and for us in public health to keep doing what we are doing and in actively managing the cases. We know that this virus is circulating, and in young people, particularly in children, they can have very little symptoms, they can have very mild symptoms. So we need to be able to manage those effectively in every situation in our community. We're doing it through this summer with daycares and summer camps. We will continue to do it in schools. to make sure that they're safe and that our children get what they need, which is so important.
Next question is from Keith Baldry, Global News.
Hi, Dr. Henry. Thanks for this. Just sort of continuing on the whole bar situation. The Canucks are in the playoffs. The NHL playoffs are about to be televised. We've got a long history and tradition of very crowded bars of people, particularly in downtown Vancouver, watching these games. How difficult do you anticipate it to be for basically authorities to police this type of behavior when we're seeing it even before the playoffs start?
Well, I was very happy to see the Canucks, and just lamenting to my colleagues who are Leafs fans. Sorry. But you know what? This is the year where we can celebrate the Canucks with our close friends or outside on a patio with a small group. And we can do that in broad places all over the province rather than just small crowded places here and there. And, we need to bear in mind, as we've just talked about, that, bars and restaurants have restrictions in place for the protection of all of us, their staff and the patrons, so that it's safe for all of us to go to work, for people to enjoy their time there. And they will be, I am sure, looking at how they can safely maximize small groups of people in those settings to celebrate if and when the Canucks keep going. But let's do it together. Let's do it with our best friends in a small group outside. And, how often can we celebrate hockey playoffs in the summer? So let's make it a special time this year to do it outside with our small groups of friends.
Do you have a follow-up, Keith?
Yes, back to the school situation, some statistics up from the United States, I think it was today or yesterday, show a 40% increase in the number of COVID-19 infections amongst children, which is obviously quite high. Does that give you any pause for thought or re-examining what's going to be happening here?
Yeah, and this reflects, and I've read that study in some detail, and it does not surprise me. It concerns me immensely. I will also say that that's still very low numbers. So the percentage of children who are ill and who get this virus is still much less than their respective proportion in the population. And we see the same thing here. We'll be presenting some more information on that. But what it does is it reflects what I've been saying, that schools and transmission in school settings are a reflection of what's happening in your community. And we know that in many communities across the U.S., there is still very high levels of community transmission with thousands of cases a day in many communities. And when schools open without having safety measures in place, which we have seen in many communities, then they can become a place where transmission happens widely. Even in those situations, though, what we've seen is when the school identifies people, they identify people who are positive, they remove them from that situation. And there's a couple of examples in the state of Georgia, for example, where the schools have closed for a short period of time. They've isolated the contacts, and then they've reopened. So it is something that reflects the challenges that are going on in communities across the U.S. and why I'm so insistent that the importance of education and the education system for supporting children, whether it's social supports, psychosocial supports, access to medical care, access to food, access to all kinds of supports in our classroom system, is dependent on all of us continuing to do what we're doing to keep our numbers low, to keep that transmission low, so that it is safe in all of our communities and we can open our schools and support our children.
We have time for one more question this afternoon. For any reporters that didn't get to ask a question today, there will be a statement released shortly. For recommendations on protecting families and communities and for access to provincial guidance on COVID-19, visit bccdc.ca. And for non-medical questions about the province's COVID-19 response, visit gov.bc.ca/COVID-19. Last question is from Tanya Fletcher, CBC.
Dr. Henry, if a student or a staff member tests positive for COVID-19 at school, can you elaborate on what the protocol will be for that learning group? Like, will everyone, say up to all 60 of them, have to go into isolation, or will they simply be told to monitor themselves for symptoms? And if we could get an answer in French as well on this, please. Thank you.
So again, this is the work that we do every day. We did it in June, where we had a couple of staff in several schools test positive. So it will depend on the situation. So it depends on when and where. If it happened when they had not been in school during an infectious period, then no, there might not need to be anybody who's self-isolating. If it happened where there was exposures to many other children, so an assessment, a risk assessment is done, and a case investigation is done by public health. And I will remind everybody that we do have school health officers, and that's the medical officers of health across the province for every school. And we're used to working with the school community around infectious diseases and other concerns in the school setting. So we do everything from nutrition and sports and physical activity to managing infectious diseases. So there will be an investigation of every single case, and then anybody who is at risk will be removed from the environment and self-isolating. So the worst case scenario would be that 60 group of people would be asked to self-isolate, be required to self-isolate. And we need to have some flexibility in case something like that happens. But it's much more likely that the unit of learning is still going to be classroom-based, and those will be smaller units. So it's still in the classroom. So the most likely transmission is going to be in a much smaller group of people, if that happens, or the risk of transmission is in a much smaller group of people. So each of those will be investigated individually.
Oui, merci beaucoup. C'est en effet le travail qui fait nos officiels de la santé publique quotidiennement pendant cette pandémie et aux autres temps aussi. La réponse, ça dépend de la situation, bien entendu. On a ouvert toutes les écoles en Colombie-Britannique au mois de juin. À peu près 200 000 étudiants ont participé et la majorité des enseignants, des professeurs aussi. Il y avait 2 cas dans cette situation, mais pas vraiment liés aux activités à l'école, et on a répondu d'une manière normale pour la santé publique. Donc, il faut reconnaître d'ailleurs que chaque école en Colombie-Britannique a un officiel de la santé publique qui travaille avec cette école. Et donc, c'est un travail normal de la santé publique. On va continuer ce travail, bien entendu, à fond pendant cette période de pandémie.
That's all the time we have for today. Thank you, everyone.